Good morning, everyone, and good afternoon to some of you joining us. Thank you so much for getting on our PATH Leadership Learning and Action Network. Today, we're going to be talking about patient, family, and community engagement. And I personally can't wait for you all to hear what our speakers have been working on to show for you all today. So next slide. I'd like to take a quick moment to thank the PATH team members that are serving as your hosts today. Tasha Peltier, lead of community engagement for the PATH project, as well as the community engagement advocate for North Dakota and I believe South Dakota as well. I'm your facilitator, Francesca Flores. You can chat with me or Tasha privately by selecting our name in the drop-down list in the chat, or you can select everyone in the chat list to ask a question. This is also the best way to give us any questions you have for our speakers to answer at the end of their presentations. Next slide. This is a brief overview of our agenda today. We have some great speakers coming in from our service units, and we can't wait to get started with them. So without further ado, Tasha, I'm going to hand it over to you.
Thank you, Francesca. Hello, everybody. My name is Tasha Peltier. I am Hunkpapa Lakota and a member of the Standing Rock Nation. I also serve as the community engagement advocate for the Partnership to Advance Tribal Health Project in North Dakota. I'm going to be facilitating today's webinar in which we will be discussing patient, family, and community engagement. Many of us have heard the term patient and family engagement, or PFE. This often refers to activities that aim to develop relationships with patients and their families to ensure that the care offered is aligned with their personal and cultural preferences and values. So that probably sounds familiar because many of you are working on things such as shared decision-making, patient-centered care, etc. But we also must think about how we can engage patients and families in other levels of facility operations. For example, policy development. Are we ensuring that the patient's perspective is considered when we're developing formal policies and procedures? Data transparency. Do our patients and families know how we are performing as a facility? How do we compare to other facilities that are similar in nature? What goals are we setting? Are we achieving those goals? Why or why not? And then also communication. Do we have adequate avenues of communications for our patient to elevate their voices, whether that is a negative encounter or positive encounter? We want to hear maybe what's going wrong so that we can address it, but we also want to hear those positive encounters because that can be really helpful in understanding what is working within our facilities. We know that having engaged and empowered patients is a very important part of improving the health of those very patients. So you'll also notice that we included the term community engagement in the title of today's webinar. That's because this is another important element to providing efficient patient and family-centered care, especially within our tribal communities. Our communities often struggle with lack of resources to meet the health needs of our community members. So by creating partnerships and engaging, mobilizing, and aligning stakeholders who share similar goals and purposes, this can allow those partners to combine resources and distribute effort and leadership and work together for lasting change. A community approach seeks sustainable solutions to population health challenges. This can be anything from encouraging engaged and informed tribal leadership to developing trusted collaborative relationships with tribal, county, and state partners, or even incorporating local cultural traditions and language into your facility's everyday operations. The important thing to remember here is to seek solutions that work for your community. So without further ado, we're going to go ahead and jump into today's presentations. We're going to hear from a few IHS facilities on what they're doing to promote patient, family, and community engagement. Our first presentation is going to be the Chinle Service Unit. I'm going to go ahead and turn it over to them and let them do a brief introduction and go ahead and jump right into their presentation.
This is Evie. I'm the project manager working with this team, so I don't mind kind of talking through some of the slides. I may not be a great service with some of the details, but I'll do my best if that's okay with the team.
That would be perfect. Thanks, Evie.
Okay, So Chinle Comprehensive Healthcare Services is located in central region, central part of the Navajo Nation. And it's a hospital with 2 ambulatory care centers, couple of field stations, and a mobile unit that visits the various communities and rural parts of Navajo. And they also offer 5 school-based health clinics. The number of employee ranges anywhere between 1,200 to 1,300 at times, so it ranges. But for now, they're documenting at 1,200 employees. Their overall objective is to build interagency, tribal, and community partnerships. That's one of their strategic goals. So next slide, please. One of the things that they wanted is priority, and I see this as a project manager, as a PATH project manager, is that they want to, and they are actively seeking to understand the community's priorities and effectively support them to address their needs. Asking why is that, and engaging into deep conversations with that. I was able to, even as a PATH project manager, sit in on one of their community health advisory boards, and you can really see that engagement, the diverse participation, the rich conversations. And it's the community members, community partnership programs, tribal programs, and I've seen even like officials or representatives from the county level that are having conversations with community to members who are in this advisory health board to talk about things that are priority to them and important to them as it relates to health, and how the hospital and the clinics can better engage with some of their topics or line items. So next slide. Can you all hear me okay?
Yeah.
Yeah, we can hear you.
Great, okay. So one of the things that Chinle has done is to make sure that there's a uniform process. There's a procedure on how to kind of institute such a task. And one of the things that they've used is the community health improvement process, and they referred that to that as CHIP. And that's the model they chose, and they started to work to form this health improvement councils, and in the Chinle, what they call the service unit. So this includes the 16 Navajo Nation chapter communities. So it's a large region, and it involved the Navajo Nation Health Education Program and the Community Health Representatives, the CHR program with the Navajo Nation. So it started off there. Next slide, please. And so through the CHIP, using the CHIP model, they were able to approach and develop and implement improvements for the community and health wellness efforts. And this particular model was developed by the Institute of Medicine in 1997 for public health work. The model consists of 2 phases and 10 steps. So the reference and the resources is there for you on the slide if you ever want to take a look at that model. And so there's phase 1 and phase 2. Phase 1 really focuses on the problem identification and prioritization cycle. Phase 2 is analysis and the implementation cycle. So on the right, you'll see the diagram, kind of the process and the steps a little bit more in detail. All right, so if you can imagine taking this model and going through all the 16 smaller communities and having engagement with community tribal partnership. It's such a detailed and very in-depth process for the folks. Next slide. And I just wanted to note that Ursula just emailed. She's having technical difficulties logging on, and so I'm hoping I can kind of communicate with her as we're moving along. Let's see here. This is the map of the part of the Navajo Nation, and these are the regional, the location, and the, I'm sorry, let me back up. When they formed the health councils, and sometimes it could be also referred to as a health advisory, board or council, but these are the ones that are active, and you'll see their names and the logos that they've even developed independently from these respective community region areas. And it's circled. So you'll see the graph, on the graph, like for the Chinle region, the chapter areas and the regions they cover. This particular council has membership from the different communities in this area. All right, next slide. Patrick Lynch was a former public health program manager at Chinle Comprehensive Healthcare, and one of the quotes that he shared with the team there, it's stood by with the team for a long time, and it made it here to the slides. And his quote is, in a way, the hospital or clinic can be seen as a wellness repair shop, while the community is the wellness kitchen or factory. So that was a perspective that was left behind and is kind of stuck with the team as they move forward the important work that they do. The community is where we manufacture wellness, and so that is a great emphasis. The health councils progress at different rates over time. The targets and benchmarks may not be met, but potentially close to reaching. So that's something that progression and that movement is really important part of the work that they do. They recognize, hey, we didn't meet it, but let's keep moving along. Let's look at the reality, the lay of the land, and what do we do as a team. The technical assistance is really vital for sustaining the activity. And that could come from any extension of each of the team members. All the team members have connections with IHS, or it could be other outside, sources, or it could be from the tribal end, or even the community itself. So that technical assistance is welcome. Support by tribal leadership also, of course, helps with the motivation and the attendance, and also keeping them informed of what is on the horizon, what they're currently working on, so that there's representation and conversations that may take place. They can best be informed to be able to be advocates at that next level. The members appointed as representatives by their chapters. So when we're talking about chapters, it's local government. So local community members come to these local government or chapters and are able to identify, okay, this individual is going to represent us at the health council level. So it's an appointed position by community members, and then voted and then recommended by chapter leadership to be member of the health committee. The more visible, involved the local community level, the core leads are, the more engagement from the community and more tribal leadership support. That's what they've seen, and it's also demonstrated. Next slide. This is a quick overview of a rubric scoring system that they're utilizing. The key on the far left corner of the slide indicates what's been implemented, what's not implemented, what's being implemented, and what's been completed. So if you take a look at that, they've set target ranges. Target numbers are indicated on the far left column. Then you'll see the Chinle service unit itself in the region, the central region, and then you have the Pinon area region, and then the Saley Clinic region. Those are the areas they cover. And then right below that, you see the elements of measurements, what they're measuring, what they're looking at, and then all the scoring systems all to the right. So the team will look at this, discuss it, and utilize it as a basis to make decisions and implement planning and move forward in the work that they're doing. Next slide, please. These are the performance target and comparative benchmarks that they've shared. And again, you'll see on the far left the segmentation, the overall performance, and then it's broken down by the different health councils. And then their measures are indicated on the right. You'll see the actual performance and then the target for 2019. So as you can see, you know, there's work to be done, and they recognize that. And so they'll go back to the council and or the community to look at where we need to address, discuss, implement, reevaluate, and design or look at the plans that we're currently working with. How do we modify that and improve certain plans? Or maybe a priority has changed for a community and the focus is totally different. So there's a lot of things that, a lot of factors that come into play when you're looking at data. Next slide, please. So the next step for this team is establishing governance structure under regional councils or group of chapters, and then exploring options for financial support for the councils, and then identify the best and spread the best practices in community engagement and mobilization. I think that is the last slide for Chinley. Thank you for your attention.
Thank you so much, Evie, for stepping in and presenting for us. We, I believe, are going to hold questions until the end of all of our presentations. So we'll go ahead and lead right into our next presentation from the Standing Rock Service Unit.
Hello, I'm Denise Cliffel, and I'm from the Standing Rock Service Unit in Fort Yates, North Dakota, and I am the quality manager. Next slide. Just a little bit about my facility, where I work. It's the Standing Rock Service Unit is the primary source of healthcare for the Standing Rock Sioux tribal population who reside in North Dakota and South Dakota with 8 communities, and some of those communities lie outside of the boundaries of the reservation. The Standing Rock Sioux Service Unit registration population is about 19,000, and our user population is 8,000. The top picture is our McLaughlin Health Center, and the bottom picture is the Fort Yates Hospital. Next slide. So patient, family, and community engagement. Why is that important to us here at the Standing Rock Service Unit? It's important to increase patient healthcare engagement and self-management of care. It's important to provide patients with the necessary knowledge and awareness to make informed decisions as part of their care, and to engage patients, and engaged patients have better health outcomes. Working towards the patient-centered medical home gave us the guidance and tools to improve patient engagement. So the picture to the right is a pamphlet of information that we hand out to our patients. We have copies of that at the front desk and in the patient rooms. We have posters hanging throughout our facility. We've promoted patient-centered medical home on our Facebook and in the newspaper, and that's how we've been trying to get the word out about patient-centered medical home. Next slide. So how are we implementing patient, family, and community engagement at the Standing Rock Service Unit? We're implementing it through, like I said, the first slide, patient-centered medical home, that model. Patient satisfaction surveys, we're asking our patients to tell us how their visits were and trying to get engagement that way to hear what they have to say. And then the community public health education. How has this been going for us? Some of our successes is that we've had improved patient satisfaction. We've had better community understanding of the opioid epidemic. One of our pharmacists has went out to the communities, to all the districts, and has met at their meetings and held question and answers and education at those. So those were, the community really liked that, where we actually went all the way out into the districts and spent time with them and engaged with them. That was been a very powerful thing for us and for them. And then also our service unit CEO, she goes to the tribal building and visits, goes to their meetings and answers their questions, and she's engaged that way, and that improves our communication between the tribe and us and the community. We have increased patient engagement with our primary care providers. We've been doing that with pictures, appointment cards, having bio cards, brochures brochures we hand out. We've promoted our providers on the Facebook and newspapers. Some of the barriers to implementing this is getting the word out is challenging. Sometimes, you know, you put things out there, but you're not sure people really understand what you're trying to say or what the message is until they really experience it. So we found that once people come in and they're able to experience the engagement with our providers in the primary center medical home, that's what's been a success for us, and that's what works for us. Let's see where I'm at. Some of our feedback is the patients have been enjoying having the one provider and forming that healthcare relationship with a team, and our patient satisfaction has been very positive. So that's how we know what we're doing with communicating with our community members and engaging them in their healthcare. That's how we know that things have been successful and improving. It used to be like people would just come in and like sign up for the day and see whoever they could see. Now we're really trying to visit with them and talk to them about who's your doctor. Let's see if we can get you an appointment with them. Really trying to incorporate that when they come in at every step of the level at the front desk. Say, who's your primary provider? Let's see if there's an appointment for them today, or maybe we can schedule you with them tomorrow. Just continuing that same talk through the whole visit from the front desk to the nurses to the doctor and for follow-up. So now we'll go through some of the key interventions that we've done. Next slide, please. So this is one of the posters that we've hung up, and we've taken this to like health fairs and put this on our Facebook page and in the patient rooms and had handouts on this. This is just tells who our teams are, who our primary centered medical home providers are and the teams, and just giving them a picture to look at and so that they can see who their providers are. Next slide. The next slide is some appointment cards that we made with the picture on there too, so they can, you know, relate with who their provider is and form that relationship. And then also we did these bio cards where it talks about the doctor, and the doctors, you know, explains their profession and what they enjoyed and some of their activities. And so those were really nice. It kind of gives them a personal connection with their provider. So that's been really popular with the community members. Next slide. So how has this impacted us? This work has positively impacted our community. Patients are receiving education on the dangers of opioids, and we want to be part of that solution. We've increased the patient's empanelment to a primary care provider, and the patient satisfaction has improved, and this is improving outcomes, health outcomes for our patients. Next slide. Positive comments that we received from our patient satisfaction survey. This might be a little bit small, but I'll read some of them. Some of them just say, thank you, my visit was excellent. I'm always treated with respect and the staff really listen. It was a great service. They were very concerned. The doctor was very kind and easy to talk to. I usually dread coming to IHS, but because the wait is so long, but the wait went along in a timely manner. The radiology staff was courteous. Thanks to everyone. One of the ones on the bottom down there talked about the doctor, and she said, I think the doctor, I believe, saved my life. And I'm very pleased with the service I received from the pain management staff at the IHS hospital in general. Thank you for the excellent attention and service provided. So this was just 1 month that came through. So this was really nice to see all these really positive things. So it's been nice to share with our staff. Next slide. What are our next steps? Our sustainability is our plan. We want to continue this. We want to grow on this. We want to move this forward. We want to continue to monitor the patient satisfaction. What is they're telling us, we really take into heart. We share that with our leadership. We look at the good things, keep promoting those with our staff, and then we also look at what the comments they're making. Is there things on there that we can work on? And we want to take those into consideration too when we're making decisions and improvements in our facility. We want to continue to update our provider pictures and profiles as new staff join, so our community members know who's working here, and so they can form a relationship with them. We want to continue to work with the hospital medication safety program. We want to keep going, promoting the opioid epidemic and treatment and our information on that. Continue to work towards our patient-centered medical home, encouraging all patients to designate a primary care provider for their health care. We're telephoning patients who have scheduled appointments with their provider and their care team to remind them of their upcoming appointments. We're encouraging patients to schedule appointments with their designated primary care provider, and we're reminding patients of preventive care screenings and immunizations to promote their health. That is it. I think that's the end. Thank you.
Thank you, Denise. And again, we'll just hold all questions to the end. Just jot them down if you have any questions for our presenters, and we'll go ahead and address it at the end of the call if we have time. Our next presentation is from the Fort Belknap Service Unit. I'll go ahead and turn it over to them. Hi, do we have Billy Joe Brown on the call?
We might also have Caitlin stepping in for them.
Hi, Tasha. This is Caitlin Conway. Can you all hear me?
Yep, we can hear you. Go ahead.
Perfect. Sorry, I was having trouble connecting. Good morning, everybody. I will be presenting on behalf of the Fort Belknap Service Unit and Billy Joe Brown and her team. Unfortunately, they are unable to join us today. Next slide, please. So the Fort Belknap Service Unit is a Joint Commission 6-bed critical access hospital. It is located on the Fort Belknap Agency in Harlem, Montana, and it also has a satellite clinic in Hayes, which is about 35 miles away. The 6-bed critical access hospital provides the majority of its care to the Gros Ventre, Assiniboine, and all other eligible Native American patients on and near the Fort Belknap Reservation. The facility also averages 39,000 outpatient visits per year, and the New Hayes Clinic, which is called the Eagle Child Health Center, can adequately serve 13,000 per year. So their IHS and tribal programs work together to deliver care to the community. As you can see, they have very beautiful facilities in both the Fort Belknap Hospital and in the satellite clinic. Next slide, please. So at the facility, the CEO and the rest of the team are very, very interested in working with and playing an integral role in the community health. They work side by side with many of the other programs and have really high priority and understanding what are the issues they're seeing, what are the causes of these health issues, and what is the availability of any resources and assets, and whether they're internal or external to them. So how do we identify those and bridge those gaps to better serve the community? They also have been working very hard on strengthening the bond between the hospital themselves and the various other community organizations. They have really formed some great collaborative work groups around the priority issues that have arisen lately and moving forward. They've been working on a greater community buy-in and that sense of ownership, really wanting people to understand the role they play in their health, so that patient-centered care, putting the patient at the center, is at the heart of the healthcare provided at the Fort Belknap Service Unit. They also want stronger relationships, and like we said, looking at what are those assets and how do we help people work on preventive care and really addressing those community health needs. And then they also, the healthy communities where individuals have access to preventive care, like I said, potentially leading to lower costs at the hospital. So that's one of their goals that they're working on as well. Next slide, please. The hospital has done a number of different patient, family, and tribal engagement activities to date. One such is quarterly community meetings. So these are offered in the evening. They are open to anyone and everyone, where they're able to bring together, they feed the community members, and really just have an open dialogue and conversations about what is happening in the community, how can they provide better services and address any of those, and they really give time and insight into all those attend. One of their most recent gatherings was around suicide awareness. They were able to have a great representation from the community, which involved even the youth, parents, and other community and spiritual leaders. They're also working on implementing a community spiritual advisory group. They're hoping to get that kicked off in the very near future and have that as an ongoing way to provide additional cultural and spiritual guidance to the facility and to the community at large. They're in the process of developing 2 traditional or spiritual leader positions for the facility. So they're moving those right along, and they are right along, excuse me, and they will be there to provide peer-to-peer counseling. We were also able to connect, and I helped them connect with the state and provide a youth mental health first aid training just a couple of weeks ago. There was excellent attendance at this, including schools, tribal programs, and the facility. That is going to be followed up with an ASSIST suicide prevention training program at the end of this month. The service unit has also offered a community first aid education. They've worked with the police officers to have naloxone training. Another connection that came out of the suicide awareness activities that are really moving full force ahead right now is they've connected with the Warrior Movement, which is empowering the youth to really drive and lead change with suicide prevention, identifying resources and people to support that area. And then through the PATH project, we've also helped them create Fort Belknap Connections, which is an online resource guide and event calendar. So it's a great way to bring together all the resources and partner with the other organizations. Next slide, please. So this is a screenshot of the homepage, and as you can see in the bottom left-hand corner, there is a link to the website. I encourage you all to check this out. We have made this for not only Fort Belknap, but also for the Blackfeet community, and working on one for the Crow Northern Cheyenne communities as well. On the first page, we give an about of the community area, and then next slide, please. Here is a little snapshot of what it looks like. So we use the Google platform. So most people are familiar with using Google on their phones. It works off that same platform, making it very easy to access and usable for patients, community members, and all others. And so we were able to work together with the hospital, who connected us with tribal programs, the 638 programs, tribal health programs, and other community groups to really bring this idea into fruition. So we were able to start small with a small group of people who realized we have some great resources and assets in our community, but let's make them readily available to our community members, and kind of a one-stop shop to find out what's out there and how do I get to it. So here, like I said, you can see that there's the various colored dots. You click on those dots and you can either search, as you can see in the community resource box, and you can go by subcategories such as health, wellness, schools, different areas such as that, or you could even search for a specific program if you wanted to look for the Fort Belknap service unit. We've also have various departments within the service units. For example, if there was dental or things like that, you'd be able to access the times, the point of contact, and the days of operation really easily. Also, sometimes email addresses or websites for various other organizations. There's also the list view, which is also shown here. So on the list view, let's say you were able to work with a patient and they wanted to know all of the different diabetes education programs in the community. Here you'd be able to easily search for that, sort it out, and show that to them. There's also another great feature that I don't have shown here is the events calendar. So once again, even though some of our communities may be small, there's a lot of overlap in the activities we're doing. So if we could all share what we're doing, it's able to increase participation, awareness, and opportunities for our community members. So the calendar is a place where anyone can add their events to the same community map and have, once again, that one-stop shop to see what's happening on locally, and to aid in care transitions, care coordination, and really just the overall health improvement by knowing what's available in our communities and right at our fingertips. Next slide, please. So the impact is, this has really, all of these different activities they've done, they have saw an increase in open communication, and also just a way to gather that patient feedback. It's really that great insight of knowing what's happening, this real-time data of how can we work on things and improve it. So they're really able to take what they hear from their community members and move forward in a rapid pace cycle of doing so. They've been able to improve their organizational image. I think the community is very happy to have those conversations and those opportunities to talk with one another and work together hand in hand to improve the health, and also have been able to improve their tribal relationships. Next slide, please. So moving forward, they plan to continue to the community meetings, like I said, on a quarterly basis, and they have hosted them in both communities. So I think they're going to continue doing that. They're going to ensure that the Spiritual Leaders Advisory Board is followed up on and does come to light. They are going to follow through on issues identified by the community. And I can honestly say I saw them do this. I've been at one community meeting, came to the next, and they made sure they addressed the issues and then brought that back. So really close that circle of communication for the community, realizing that they listen to what is heard and then offer opportunities and solutions for those. Their goal is to continue to use and spread the use of Fort Belknap connections, so not only internally, but hoping for continued adoption by other programs, patients, and community members at large. And then they are going to develop future community activities that can be ongoing, such as community first aid and other youth and overall community engagement activities. So thank you for your time, and I will now pass it on to the next person. Thank you.
Thank you, Caitlin, also for stepping in and presenting for us. I think now we will go into any questions. Francesca, how much time do we have for questions and discussion?
We have about 20 minutes for questions and discussion.
Do you want to go ahead and guide them on how they can present their questions?
Absolutely. So if you have any questions or comments on any of our speakers' topics, please go ahead and put it into chat. If you are able to, go ahead and unmute and ask the question now. So we have one. Oh, go ahead. Go ahead, Tasha.
Okay, so we have one question in chat for the Standing Rock Service Unit. It says, how far out can one make an appointment? Do any of you have some?
I have some answers for that. I'll just talk instead of trying to type it. So this is Denise, and we have about 2 days. Sometimes it depends on what you're coming for. So our schedule is uniquely matched so that we have same day appointments for urgent care kind of things. Like if you think you might have broke your arm, we have some slots saved for that. But if it's like a med refill or a chronic care appointment, usually those are about 2 to 3 days. Sometimes, occasionally, if there's something going on and we have a lot of doctors on leave or something, it can get close to maybe like 4 or 5 days. But for the most part, you can get in within 2 to 3 days. Unless it's something urgent, then we have spots saved in the morning and the afternoon for those kind of urgent things that need to be seen. That's been really unique. We've worked really hard with our moonwalk and our scheduling to get those appointment slots like that. You may not always get, I think I know what your question is, will you get to see your primary care provider? You may not. If you're on that urgent care thing, you may get to, you may not, depends on if your doctor has an opening or a cancellation, or you can go on like a little wait list and wait to see if one of their appointments cancel, but we'll get you seen. But as far as getting to see your doctor for like a diabetic appointment or a med refill, probably 2 or 3 days would be, and you could see your primary care provider.
Thanks, Denise. There is also another question from ACL asking what were some of the community issues that were identified. I'm not sure what facility they're asking that question of. If you could. Oh. Is there any of the presenters that wants to answer that question? I think we have a couple. Chinley and Fort Belknap talked about some community discussions. Do either of you want to touch on that, or are you able to? Yeah, Fort Belknap, it says. Caitlin, can you address that question? They're just wanting to know what type of issues did the community identify, those collaborative discussions?
So the suicide awareness has been the most recent discussion.
Sorry, I got double sound going on. And they were also able to look at some of their contract health work. How does that work, and how do they make sure payments are made? That was one of the other things that was discussed, and they were able to make some pamphlets around that. I can also follow up to find out from additional ones. Like I said, I've attended a couple, but I know they host them quarterly, so I could follow up and see what some of the great issues that came out of that.
Fortunately, I know one thing that the group from the executive team had shared was that when they were first developing community health councils, coming from the communities or the local government, the chapters, one of the things was they wanted a process in place to, when some of these community concerns come up regarding healthcare, how does it get to the leadership team, the executive team, or the governing board members? They wanted to make sure that the health council was able to report and work with those hospital exec teams so that the community is heard, and that it forces them to revisit some of their the hospital service units strategic goals and ensure that so in that fashion the community initially, when some of these councils were being developed, those were some of the things about those were some of the concerns they had. There's a lot of things that come up, everything from getting to their appointments, there's dirt roads, there's days where it rains and snows, and getting to appointments might be a struggle, and questions on how does the hospital accommodate such things. The quality of care, of course, is always a concern. Customer service is a common thread with all of the regions. So, and I think the other thing that really was important, and it really displays itself with Chinlea's, is that the cultural adaptations, the cultural integration, the traditional fundamental I don't want to call it laws, but the ways of understanding about health is integrated into the delivery of care is also another component that always came up through conversations with the community as well.
Thanks, ladies. That's great feedback. I want to go back a little bit to Renee's question. She had a question for the Standing Rock Service Unit about their access, and she wanted to know how far out is their access.
Hi, Renee. This is Denise. We are currently, our access is about 60 days right now. We're currently working on getting that up to about 90. So far the 60 has been working pretty well for us, but we're trying to work towards the 90. Thanks.
Okay, and then we have, oh, it looks like Caitlin is addressing the question for Fort Belknap. Did I miss any questions, Francesca?
This is Caitlin. I did also want to add about how do you maintain that active participation. I think one of the key things that I have seen Fort Belknap do is really making sure the follow-up and follow-through. So I think that's been really positive so that they, like I said, see that when they voice their concerns, that it is addressed in somehow. It's not always the solution that the community member may have wanted, but they address their concern and show the rationale of why it is the way it is or how they can improve it. And so I think just really giving validation to the voice of the patient and the community has been a very resounding positive impact.
This is Abby. I don't think Ursula is on the call, but I'll comment. I know that for Navajo area and region, a lot of their hospitals have a strong community health, public health divisions, and they work very, very closely with their clinical divisions and counterpart. One of the things that's very strong and prevalent is, this is to add to Joanne's comment and then kind of comment a little bit about the participation rates and trying to keep that a sustainable level. First off, they offer a lot of community events. There's health fairs, there's walks, there's runs, there's cooking classes, demonstration classes. There's a lot of relationships that are built early on, and it's taken the hospital many, many years to establish these relationships and to sustain them. So there's a local, a community tribal college, Diné College is available. There's the Navajo Technical Institute. There's universities that they connect with. There's the local high schools, public schools, county health department, state, and even some federal programs. And of course, one of their most important allies is their local traditional healers and leaders. So they make sure that everyone is always involved in the activities or opportunities for health education, health promotion. They're always very active, and I have to say their community health and their public health departments is actively engaged. That's really the drive and the foundation and the baseline work that they had to do to establish that participation, continued participation in some of these health councils. So they had to establish that relationship, that rapport, and that trust to say, oh, IHS down the street is going to create a health council. And so it took many years for that. And then, they were able to build that. So I hope that kind of answers to some of the questions and comments.
Thanks, Evie. We do have an additional question for Standing Rock. How many clinic providers do you have?
Hi, this is Denise. So we have 9 clinic providers that service the Fort Yates Hospital, the McLaughlin, and the 3 field clinics we have. And they're very patient-focused providers. They want to get patients seen. They work really hard at getting them in and getting the needs seen for whoever comes to the clinic for that day. So we're very fortunate with our staff. We have very good staff, and we're very glad that they're part of our team. Thanks.
Okay, so an additional question, for Standing Rock, how many visits per day do you have?
I don't look so much day to day, but I do a lot of month gathering. And last month we saw 906 in our clinics.
Thank you.
Okay, well, if there's no more questions, or if you do have additional questions, please leave them in chat and we'll follow up with our speakers offline and get back to you via email. I just wanted to thank everyone once again for joining our LAN on patient, family, and community engagement. Our next LAN is going to be October 2nd, first Wednesday of the month, as always, on sustaining improvement. And we hope you all can join us. And we just wanted to say thank you again for our speakers and the time that they took to put these slides together and all the great work that's happening in our communities.